after learning she would lose her physician at the Eagle Creek Medical Clinic, and she quickly realized she wasn't alone.
Camille Curry, she joins me now, founder and organizer of BC Healthcare Matters. Camille, thanks a lot for coming on today.
Oh, thank you so much for having me.
Okay, congratulations on your success so far in highlighting this issue. I think you've done a really good job of it. We saw a big turnout at a rally at the BC legislature. Yeah, how do you think we got into this position? Like, I've just been checking out your website here this morning, and there's a lot of good background on there. Like, for people who are wondering how we got into this situation, how did we get to this point, do you think?
Yeah, so it's definitely something that's been coming on for a long time. You know, one of the saddest things is that when you go to look up, if you even just put in BC family doctor crisis, you'll find news reports from 10 years ago even. And so this has been coming for quite a while. But I think the most, kind of poignant things that have happened in the last, say, 5 years is that there's been a mass redistribution of our healthcare funds. And a lot of that has gone into these urgent primary care centers. And so the government decided in 2017 that it was going to be their initiative to transform the healthcare system. And I think the problem is that right now, 5 years later, we're looking at the system and we're not seeing the transformational changes that they had promised. And we're just seeing a lot of our healthcare money being used in areas that are not providing tangible benefits to the citizens. So, when people are concerned about, well, the doctors are out there saying that they need more money and we don't have more money to give. Well, I would suggest that, it's important for us to hold our government accountable and demand more transparency, and for us to take a look and see what are these urgent primary care budgets, how much are they costing, and is this the appropriate use of our healthcare ministry funds right now? The other thing I think that people don't realize is the effects that this is having on every layer of our healthcare system. So while it may seem like a daunting task to consider paying family doctors any more than they currently receive, I think people need to also consider that no matter what, that child that has strep throat, if they can't get in to see a family doctor today, their mother's going to take them down to the ER. And that ER visit is going to cost, $500 to $1,000 of taxpayers' money. So there are a lot of ways that if we made the appropriate corrections and put the money back into our community family physicians, that we could lower the costs to us, the taxpayers, and basically just do some redistribution. So I think that, I'm glad the government says that they're in talks with associations and with the docs of BC, but I don't think all the changes are going to come from the Physicians Master Agreement either. The doctors need more money, that's for sure. It's been made clear by themselves and their associations, and I fully support that. But we will also need the government to think a little further outside the box. I think that to suggest that one fee and $1 amount will suit every citizen's need is basically ludicrous, frankly. And if we look at other provinces within our country, they do it in other ways, and they do provide, as that physician suggested, things that are called like time modifiers that allow them to bill for that extra 15 minutes that they needed to spend with that senior who perhaps had multiple issues that day, or who just needed things explained in a little bit different way that took more time. So I don't think that it's unreasonable. They're not asking for something that doesn't already exist. That type of pay model already exists within our country. So I think it's time for us to get on board with not reinventing, and instead let's do some replicating of the successes across Canada. These doctors are definitely asking for basically just equitable pay with the other career paths that they have the option to choose, right? Okay. So we don't want to keep losing them all to hospitalist positions.